The death of 24-year-old Marcus David Peters in Richmond nearly 3 years ago was one of those catalysts for changing how mental health issues are dealt with, not just here in Richmond, but across the Commonwealth.
Turn 4.
It wasn't any doubt in my mind that he was going through a mental health crisis and he needed help.
29 months have now passed since 24-year-old Marcus David Peters died after being shot by a Richmond police officer. Peters was naked and unarmed at the time, and family members say having a mental health crisis. 2.5 years later, the Marcus Alert Bill is now a law.
Well, what do I think now? Hopefully we'll have more qualified people that can go out and assess people with mental health crises.
The new law designed to create teams of mental health service providers and peer recovery specialists to accompany police officers responding to a crisis call. Frazier, a social worker who served on Richmond Mayor LeVar Stoney's task force for re-imaging public safety.
So when we think about public safety, a lot of times we often default to the police, right? But we need to expand the definition of public safety, right? Because people experience mental health crises all the time. And if we expand that to include, mental health professionals, like what the bill is talking about, having peer support, we can address a lot of these issues.
Just hours after the bill is signed into law, officers in Chesterfield County spend hours dealing with a person threatening suicide.
We ask the law enforcement to do things that are outside of their purview.
And part of sending out social workers for intervention, Frazier says, must include those culturally competent.
Being aware of the community that's being served and the needs that the community, putting those needs first, as opposed to criminalizing people for having mental health or substance abuse issues.
And out of the Marcus Alert law, Frazier hopeful.
We need to destigmatize mental health.
The Marcus Alert law now requires response teams to be up and running here in Virginia by the end of next year, and the new law also stipulates that a statewide call center be up and running by the end of 2021.